Peripheral nervous system is, show labels. All right. These are the nerves that come off the brain. Remember, the cranial nerves do not go to the spinal cord. They come off the brain directly. And you have the optic nerve, which is your cranial nerve number 2. Okay, connects to the optic chiasm. It extends to the optic tract, and extends back to the superior colliculi into the occipital lobe. You have the trochlear nerve, which is cranial nerve number 4. The trigeminal nerve, which is cranial nerve number 5. Facial nerve, cranial nerve number 7. Glossopharyngeal, which is 9. And below that is the vagus nerve number 10. Okay, accessory nerve number 11, as it comes down on the base. You can see going to the cerebellum. Hypoglossal nerve number 12 connects to the tongue, motor nerve for the tongue. Vestibulo-ocular nerve number 8. Abducens nerve number 6. Oculomotor nerve is number 3. You see there's a real good optic chiasm right here. You can see that optic chiasm as it crosses over from right to left. And there's your olfactory bulb, which are the ends, and there's your olfactory tract as it feeds into the olfactory nerve, which is cranial nerve number 1. Okay, looking at the cranium, you can see the olfactory bulbs. Okay, you can see the trochlear nerve, cranial number 4. Abducens nerve is number 6. Glossopharyngeal and the vagus nerve, which is numbers 9 and 10. Vertebral arteries that branch up into the basilar artery, which feeds into the cerebral cortex. Accessory nerve number 11. Spinal cord, which runs through the foramen magnum. Trigeminal nerve is number 5. Oculomotor nerve is number 3. And the optic nerve is number 2, coming right off the back of the eye. You can't see the optic chiasm very well. You can't see it all here. Number 3, this is the ear. Again, we haven't done these structures yet, but we'll get into it in the next couple of chapters. The internal acoustic meatus is the opening for the ear. The vestibular cochlear nerve is nerve number 8, runs across the internal acoustic meatus. Facial nerve number 7, and the vestibular nerve runs across the top of the internal acoustic meatus. Okay. Looking at the side view, the sagittal section, the optic chiasm, which is cut in half, so you can't really see how it crosses over. That's where the optic nerve crosses right to left, left to right. You see the pons, which is separated from the cerebellum by the medulla oblongata. So there's your pons. You have your spinal cord, which extends down from the medulla oblongata to the brainstem. You have the ventral roots of spinal nerve from C1 down from the spinal column. You have the trigeminal nerve number 5 coming out just to the base of the pons. You have the oculomotor number 3, the olfactory tract, and the olfactory bulbs connects to the olfactory nerve, which is cranial nerve number 1. You have the accessory nerve that enters from the foramen magnum. And these are the dorsal roots of spinal nerve from C1. Okay? And C1 is the atlas. So those are the dorsal roots of the atlas. And you see the accessory nerve, and you see the rest of the spinal cord coming down. Okay, if you look at the very back, you have the branch of the dorsal rami of the spinal nerve. Remember, the spinal nerves come off. You have the dorsal nerve goes into the dorsal ganglion. The ganglion's where the synapse and the cell bodies are. And as those extend out, those become the dorsal rami of the spinal nerve. So you got your dorsal nerve, you got your dorsal ganglia, then you got your dorsal rami. Okay? And those are sensory nerve. Those are nerve input coming into the body on the dorsal root. Okay? You can see the dorsal rami of the spinal nerves again after the ganglion. Dorsal roots of the spinal nerve. Okay. So here you have let's go in order. There's the dorsal roots of the spinal cord coming off the spinal cord. So you got your dorsal root ganglia, which are the swellings of your cell bodies. Then after the dorsal ganglia, you have your dorsal rami of each nerve that extends out. Okay? And these are your spinal nerves. Okay, they have ventral and dorsal nerves in them. This is the ventral rami of the spinal nerves. Okay, this is the ventral roots of the spinal cord. So again, you got your ventral roots and your ventral rami after the ventral roots and the dorsal ganglia. Okay, where's your ventral root ganglia? Can anybody see them?
No.
No, because there is no ventral root ganglia. Remember, there's no such thing. There's only dorsal root ganglia. There are no ventral root ganglia. It goes directly from the ventral rami into the ventral roots and back to the spinal column. So there is no such thing as a ventral root ganglia. That's why you can't see them. Okay. Brachial plexus up in the shoulder. This is your cervical plexus coming down from the neck. The plexus just means a braiding or interconnection of nerves or blood vessels or whatever. That's what a plexus means. It's like a braiding of everything coming together. Okay, you have trunk of the brachial plexus because it comes through the shoulder. You have the lateral cords of the brachial plexus and the musculocutaneous nerve after the brachial plexus. You have the radial nerve that branches off the brachial plexus. You have the radial nerve, the median nerve, and the ulnar nerve. The radial nerve runs down from the brachial plexus along the posterior section of the arm. Okay. The median nerve runs to the between in the middle. The ulnar nerve runs along the medial aspect of the arm as it comes down. So you see your ulnar nerve branching down the median. You see your radial nerve coming up higher there, going down the lateral portion. And the median nerve runs between the two, coming off the brachial plexus. You have your axillary artery, okay, which branches off the aorta. You have your ventral rami of the brachial plexus. Again, there are no things of ganglion. So you have your ventral rami. Okay, so the ventral rami feeds into the ventral root, and ventral root feeds into the spinal cord. You have your phrenic nerve, controls your diaphragm, your breathing rate, and the vagus nerve. Okay. Looking at the side view again, you can see the ventral rami, spinal nerve C5, okay, fifth cervical vertebrae. And we see the lateral cord of the brachial plexus, the medial cord, the musculocutaneous nerve, the median nerve runs off the plexus. Remember, you got your radial nerve, your median nerve, and then your ulnar nerve. The ulnar nerve runs on the medial aspect. You have the subclavian artery that branches off the aorta. Okay. The ventral ramus of spinal nerve C7. Again, those are impulses going, those are motor impulses. The ventral nerve is your motor impulse. They're efferent. That's your ventral ramus. So you went from your ventral nerve to your ventral ramus with no ganglia in between. So it's the ventral of spinal C7, ventral ramus of C8. This is below it. The common carotid artery, ventral ramus of spinal nerve C6, and the vagus nerve that runs down along the side around the common carotid artery. All right, so looking at the hand, you can see the median nerve runs along the side. You can see the radial nerve runs on the thumb side, the lateral border, and the ulnar nerve runs on the median border. Okay. You have the palmar digital branches of the ulnar nerve, and you have the palmar digital branches of the median nerve. Okay, down by the abdomen, you have the genitofemoral nerve, okay, that runs down along the femur bone, the lateral femoral cutaneous nerve, and the femoral artery. Femoral artery is their femur bone. That's when it's a large artery. That's the one that we're worried about with during auto accidents or any kind of trauma to the legs. That's the ones with cause internal bleeding. That femoral artery. That's the femoral nerve. I'm sorry. The femoral artery runs alongside of that, but this is the femoral nerve. So when you break your femur, that's the one that hurts. That's when that transmits pain. Okay. Sciatic nerve. Everybody's familiar with that as it runs down. Okay. Okay. It breaks into the tibial nerve and the common fibular nerve. And you have in the foot, you have the deep fibular nerve. Okay. Extensor hallucis longus muscle. We talked about it innervates the hallux, the big toe, and the tibialis anterior muscle. All right. Let's do the quiz, and then we'll take a 10-minute break. Because we did the quiz after, we'd forget everything, right? What structure is highlighted? Ventral ramus of
C5.
Is that C5? Good a guess as any. That is hard to tell. No, C7. I would not expect you guys to know that. I mean, unless you could see the vertebrae and count them, you know, that's a we know it's a ventral ramus, because that's ventral ramus of C7. There's two. All right, what structure is highlighted? That looks like C1, not C7. So if you go by C1, by the atlas, it's either the dorsal rami or the dorsal roots or the ventral roots. To me, it looks like it feeds into a ganglion right here. So that was symbol dorsal. But again, that's what it looks like. So I would say the dorsal roots. I would say dorsal roots, because there's your, if I'm right, these are the dorsal roots, these are the dorsal ganglia, and then this is the dorsal rami coming off. But that's my logic looking at the picture. But they might not agree with me. But they did. Everybody follow the logic? At least it made sense to me. When nerve comes down the medial aspect of the arm?
Ulnar.
The ulnar nerve. Ulnar nerve is on the medial aspect, the median is in the middle, the radius is on the thumb side or the lateral border. Okay. What structure is highlighted? I don't even see the highlight. Okay, it's behind the plexus. This little highlighted area right here. I would say that's look at the posterior cord. It looks like the back cord to me. It looks like the posterior cord. No, lateral cord. I couldn't tell with the picture. Is there a cord behind it? Okay. They're saying that's a
rectus capitis posterior major muscle.
Okay. I don't know where that one came from. I really don't. Don't know what I hit, but it's not even up there. That's the lateral cord. Yeah, look at the cranium. That's one of the cranial nerves. What nerve is that? Facial nerve, the decussate nerve 9, or the trigeminal nerve 5. It's really hard to tell, but I would say that's somewhere around the 8th or 9th cranial nerve. If I had to guess, I'd say the glossopharyngeal nerve. Anybody have a better guess? No, it's the abducens nerve, number 6. It runs right there. Okay, which nerve is highlighted?
Radial.
Radial nerve. Good. What structure is highlighted? You can't. Ventral. Okay, it's the ventral ramus, but is that C5, 6, 7, or 8?
It was 7 last time, so must be 7 this time.
Okay, we'll go with C7. Ventral. I can use the ventral ramus. I can't go with C7 then. No, C8. Like, I would not expect you guys to know that. It's because you cannot see the vertebrae as you're coming down, but you know it's in that area. What nerve is highlighted? Okay, it's a nerve that's going to run down the medial aspect of the arm.
Ulnar?
Ulnar nerve runs down the medial aspect. Which cranial nerve is highlighted there? That is either 5 or 7. Well, maybe not. Maybe it's the ocular. Dang, it's hard to tell from that angle. If it looks like it's innervating, see, this goes to the eye right here. That's the optic. But it looks like it feeds up into the rectus muscles of the eye. So I would say oculomotor. Anybody got a better guess? Correct. Oculomotor. Okay, what structure highlighted? Okay. Are they ventral rami or dorsal rami?
It looks like they're roots going into
that swelled area, right?
Yes.
It looks like going into ganglia. So I would say those are dorsal. And are the dorsal roots or the dorsal rami?
I'd say the roots because it's not off the other end.
Dorsal roots between the spinal cord and the dorsal ganglia. That's what it looks like to me too, the dorsal roots of the spinal cord. Ventral roots of the spinal cord. See, it looks to me like those are feeding into these ganglia right here. But I guess these are feeding into the ganglia, these are just behind it. But it's not a good image. So I would count that correct as dorsal roots of the spinal cord. Because it looks like they feed right into the ganglia there. Okay, which nerves are highlighted? Coming off just above the superior border of the pons. If I guess, I would say that it's either trigeminal or the facial, I would think. But I think it would be the trigeminal. Nope, trochlear, number 4. It's hard to tell whether 4 or 5 or where they branch off. But that says trochlear. 12. What structure is highlighted? I can't see what's highlighted. Let me take the highlight off. It's just, it looks like this structure right here. Which is your esophagus. The esophagus down there feeds in the trachea. This is your pons, cerebellum, cerebral cortex. This could be the. No, come on, get my picture back again. It does look like the oculomotor nerve. It's not the optic chiasm, I don't think. But it's hard to tell on that angle.
Is it the olfactory bulb?
The bulb should run up to here, though. This acribiform plate, the bulb should be right here. Should be. Because the bulb extends above the sinus. Let's try the olfactory bulb. I think it's more anterior, though, but no, the optic chiasm. Again, that's hard to tell. That's really hard to tell that's an optic chiasm. If I gave you a test question, you would see the cross. You'd see the X. All right, what cranial nerves are highlighted here? I got to turn the highlight back on, don't I? Okay, what cranial nerve is that? This is number 11. That's your accessory here. This is 12. That's the vagus. So it's got to be between around number 7. That's the trigeminal. That's trigeminal adducens. So it's got to be facial nerve. Maybe. I would guess at facial nerve. Yep. Once in a while, I'll get one right of those. Those are hard to tell. All right, what structures are highlighted? Dorsal roots, ventral roots, dorsal roots, and dorsal rami. C1 or C7. Okay, so right now, this one's at, you can tell between C1 and C7, what's it going to be? C1 or C7?
C1.
C1. That one we should know because you can see the vertebrae. So this is going to be at C1. So it's either going to be the ventral roots, dorsal roots, or the dorsal rami. Holy cow. And okay, if I gave you the test, I would show you where it connects, where you can see a ganglion, where there's past the ganglion, before the ganglion. I really can't tell. Let me see if I can take the highlight out and see a little bit better. But I can't see any other connecting nerves with it. Turn off highlights. Do you see what it's pointing at?
No. A blank space.
A blank space. It's not pointing to any nerve. I can't tell you. It doesn't look like it's pointing to any nerve at all. I don't see any nerve where it's pointing. So it's pointing to the ventral roots of spinal nerve C1. Yeah, right. I really don't see that. I mean, I can see C1 because there's C2, C3, C4, and so on. You see the first cervical vertebrae right here. So C1 I'll give you, but after that, it doesn't point to anything. Which nerve is highlighted? What nerve runs down the side there?
Phrenic.
Phrenic nerve runs down, innervates the diaphragm. No, vagus. The vagus and the phrenic both run down there. Remember, the vagus nerve is one that we use for the chokehold for the police. That's the vagus nerve that they're inhibiting. That's also one that was inhibited for that, like in a lot of the murder for John Benet Ramsey. And we can do that case. All right. This is what nerve is highlighted here. This
femoral.
is the big, the femoral. This is the big nerve that runs down by along the femoral bone. That one I can see. That one points to a nerve. The highlighted nerve innervates which of the following muscles? Okay, that nerve is fibularis longus or the tibialis posterior. The soleus is up higher, the tibialis anterior. I would say it's a deeper nerve. So I'd say the posterior, tibialis posterior, but it could be wrong. No, tibialis anterior. It looks to me like it's running a little deeper. Like I said, I show you views that show you how deep the nerve actually runs, whether it's by the tibia bone or the fibula bone, or whether it's anterior, posterior. The highlighted structure passes posterior through which cranial structure? Okay, so this is passing through this cranial structure right here.
Optic canal.
Okay, the optic canal of the sphenoid bone, jugular foramen, carotid canal, superior optic fissure of the sphenoid bone. Optic canal of the sphenoid bone is what it looks like. Or
Because it's going to the optic, it's the optical nerve.
it looks like it.
And it's the foramen that it goes through is the optic canal. So
Optic canal of the sphenoid bone. Perfect. Logical reasoning. Which of the following statements best describes a highlighted cranial nerve? This was nerve number 10, right? This was your vagus nerve. So which one describes it best? Innervates the trapezius and sternocleidomastoid. Transmits 75% of parasympathetic outflow. Transmits 70% of the sympathetic outflow. Innervates the muscles of facial expression. Is it parasympathetic? We have not gone over that. And the cranial nerve intense controls your respiration, controls your heart rate. I would say the parasympathetic outflow, but okay. I don't think I wouldn't expect you guys to know that one, but it's the cranial vagus nerve controls your heart rate, your breathing rates, things like that. That's what's used for the chokehold because it does control that. And those are parasympathetic functions. All right, last one. Then we'll take a break. Highlighted nerve carries sensory information from the what?
Vestibular apparatus, the internal.
The inner ear.
Just the ear.
Olfactory. Is that cranial nerve number one? Okay, let's go with vestibular apparatus of the inner ear. Perfect.